Hello, I am Dr. Polley and I am a GP in Hoedspruit, and it's been such a privilege to serve this community. I hope to share some nuggets with you and that you can learn something from this video. So malaria is a parasitic infection that is transmitted from mosquitoes to humans, and it basically enters the bloodstream when an infected mosquito bites you, and it goes to your liver where it can lie dormant for quite a while, but commonly after about 10 to 14 days you start getting an infection, and the infection commonly presents with fever, headache and abdominal pain. Other symptoms are nausea and vomiting, diarrhea, body aches and pains. It almost feels like you have a really bad flu. Hoedspruit is a malaria area, and on the National Department of Health website you'll see Hoedspruit falls under the intermediate risk area, but your higher risk is if you travel into the actual Kruger or if you cross over into Mozambique and come back. That's when we see most of the cases, but we have seen a few cases that arise from Hoedspruit itself. So the National Department of Health does recommend that you use prophylaxis when you're visiting Hoedspruit. So the good news is malaria is preventable. The main ways that we prevent malaria is through just behavioral changes. So we want to be able to cover our bodies, especially from the hours of dusk till dawn. So it's best to wear long sleeve shirts, long trousers, but in Hoedspruit we know it's very, very hot and wearing long sleeves is not really doable. So you want to get yourself a good mosquito repellent and put that on you before it gets to dusk. And then sleeping with mosquito nets, make sure it doesn't have holes in it, and using fans and air cons is another way to deter the mosquitoes. And then obviously there's medication. So the medication prophylaxis, I would suggest that you see your local doctor and have a discussion with them about what option is right for you, based on your medical conditions, your age, your risk, exactly where you're going to be traveling, if the benefit of the medication will outweigh the risk of getting malaria.